that, I mean, everybody here has mentioned that you want to provide health insurance for your employees. In some cases you can, in some cases you can't, but cost is obviously the number one issue out there. And you know, we hear about mandates, and you all have kind of touched on it a little bit about what a mandate would do to you, do to your company. Then we also hear about maybe the possibility that if there's some sort of government option that it is going to, you know, provide an opportunity to be lower. But, you know, if we look at the way the government has run Medicare and the way the government has run the VA health system, you know, we hear complaints in my office all day long coming in about the problems associated with their coverage from Medicare, or even, you know, throw Medicaid in there too. And look what the costs have done there. The VA system alone in the last decade, you know, we have doubled the expenditure, more than doubled the expenditure, at least in the last 8 years, or the last 9 years, to the VA system, and the costs just continue to go up. And there is a government-run healthcare system right there. So if you have a situation where, and I'll ask all of you, if you have a situation where you are mandated to provide that coverage, and those costs continue to go up, you know, and even the government system, you know, obviously, what is that going to do to you? And I guess some of you have already answered that. And you know, it's unfortunate, too, because we haven't really gotten a chance to talk about the Chairwoman's bill and my bill with pooling, because I think that offers great opportunity. If you've got a business with 10 employees or 7 employees, and it's pretty hard to go out and get health insurance. But if you can pool together with 100 other businesses with 7 employees or 10 employees, your buying power just got a whole lot better. Yeah. And it was touched on when it, obviously, too, when you talked about medical malpractice reform, which is a huge cost driver. But I guess, you know, we're kind of talking today about these mandates, and, you know, I just want the, you know, what's the one thing it's going to do? Are you going to be able to stay in business, or are you just going to, you know, quit business? Are you going to, you know, drop employees? What are you going to do? Just the quick answer. If you're mandated to do this. And I don't see any reason why costs are going to be contained just because the government has an option out there. I think it's going to make it worse. We'll start with you, Mr. Thompson.
Yeah, Ranking Member, I think that we would continue to do everything in our power to keep our head count down, reduce our employment levels. We may invest in more technology than we already have, but obviously, as healthcare costs rise, we just look at every other way we can continue to maintain our business and keep reducing the employee cost, which means we're going to hire less people or lay people off and reduce our headcount on a continuing basis. I don't want to do that. I've been in my community for, you know, nearly 115 years. My family started the business. I mean, I have deep, deep ties. I want to hire people. I want to hire a lot of people. It's one of the stakes in our business. It's, you know, I have shareholders that I have, or stakeholders. I have the community. They are stakeholders. So we want to do this, but we don't have any choice. I have to be profitable. I have to report to shareholders that demand that we be profitable or don't lose money. So we'll do whatever we can, and if it means cutting headcounts, that's what we'll have to do. But it pains me terribly. I mean, that's the worst thing I could possibly do in my business, and I don't want to do that.
Mr. Nicholson?
Yeah, I guess we're talking about mandates as if it is, without getting into the details of how you administer the mandates. Yeah. And I think we have to look at some of those if we're going to examine a mandate program. But one of the things, for instance, that we have done when we ran into a similar situation where we were going to take a government contract, which we eventually decided not to, we looked into one of the problems was that we realized we had to go out and hire independent contractors to get accomplished what we were going to do, and that took them off our payroll so that we could then meet some of the federal restrictions on payroll and cost plus and so on and so forth. I suspect that if we end up with some sort of an employer mandate, there's going to be an awful lot of looking closely at all of the little tiny details. And to me, the way you handle that, if I were in your shoes, would be to require the private insurers to have the mandate restrictions, but let them negotiate with us employers, so that we can then not get into trying to find a way around this or that and make them responsible for getting the various objectives accomplished by what you want to have done.